Riverside Healthcare puts the health and wellness information you need well within reach.
Hello, listeners, and thanks for tuning in to the Well Within Reach podcast brought to you by Riverside Healthcare. I'm your host, Liz Unruh, and joining me today is Logan Miller, who is the Donor Relations and Estate Planning Manager with the Riverside Healthcare Foundation. And today we're going to be talking about year-end giving in the Riverside Foundation.
Healthcare can be confusing, but thanks to your My Riverside MyChart, you can easily manage not only your care, but your family's as well. With a single click, your My Riverside MyChart lets you stay well connected to the same information your provider sees. You can view your health history, get test results, request prescription refills, pay your bill, or make an appointment. Manage your care from anywhere, your laptop, phone, or tablet. Learn more and enroll today at riversidemychart.org.
And we're back. Thanks so much for joining us today, Logan.
Thank you for having me. I appreciate it.
Yeah, can you tell us a little bit about yourself and your role here at Riverside?
Yeah, I have been at Riverside for just under a year. Like you said, I'm the Donor Relations and Estate Planning Manager. And so basically what that means is my job is to build relationships and build bridges between those who want to give generously towards Riverside and plug them into programs and impacts that match well with their interests.
Yeah, I think that's a great description of what you do. And I think that's a big part of foundations is building relationships and looking for funds that meet people's needs. And we have a vast variety of funds available here at Riverside. But to start, can you talk a little bit about what the foundation is and how it supports our mission here at Riverside?
Yeah, absolutely. And I think the biggest thing to note on the front end of that is that Riverside is 100% a community hospital. We are a 501c3 organization, and we don't have a for-profit arm that raises money to fund our programs. So the foundation is really important. The foundation is the fundraising arm for Riverside Healthcare. And so what we do is fund projects and programs that go beyond the scope of our annual operating budgets departmentally. We focus on initiatives that advance cutting-edge care, improve the patient experience, strengthen overall health of the region. And every dollar, this is what I like most about what I get to do, because I get to see it up close, but every dollar that we raise stays local, ensuring that our neighbors, our family members, our friends have access to exceptional health care right here at home.
Yeah, I think that's really important that the money stays here in the community. So you know that if you donate to Cancer Care at Riverside, it's going to help improve the cancer care that we can provide here in town versus having to travel up north. For someone who thinks they have never interacted with the foundation or perhaps haven't, what kinds of projects or initiatives do you typically help fund?
The foundation essentially funds four things: facilities, equipment, programs, and scholarships. Facilities, a great example of that is the expansion of the Cancer Center in Bourbonnais. So physically, the brick and mortar of that building, the foundation funded to expand so that we could increase our capacity at that site. Equipment, things like the linear accelerator, which delivers radiation therapy, neurosurgery. We've contributed a lot to equipment in that region as well. And our largest campaign yet was for the Heart and Vascular Institute, which we helped equip the interventional suites in the hospital as that was being built out. We don't have enough time here today to talk about all the different programs we have. I know you're aware of all of them. But, a couple that are really cool is one of my favorites is the Glenn's Guardian Angel. Our CEO and his wife, Phil Cambick and Linda Cambick, started this fund because we recognized there was a need of people coming into our behavioral health inpatient unit, for instance, in the winter, in shorts and a t-shirt. And if you've ever been in Northern Illinois in the winter, you would know that that is a poor time to be wearing shorts and a t-shirt, right?
Yes, for sure.
Dangerous, to say nothing else. So they started this fund where we physically buy new clothing, new shoes, new long pants, sweatshirts, things that keep people warm, to give to people if they're coming in under-equipped. So when we talk about healthcare, we're not just talking about maybe the direct healthcare, but maybe in an indirect way as well, that the whole person is leaving better than we found them. So Glenn's Guardian Angels are really cool program that I get to see as we have those materials come into the foundation and get to disperse to that department. It's a cool thing. Reach out and read. We have books that the foundation pays for that we put in all of our pediatric clinics. I know you have a little one.
Yes.
I have some little ones. And so when they go into their appointments, they actually get to pick out a book each year that matches not only their age, but their ethnicity as well. So they're getting to see the main character of a story that looks like them. So that's a really cool program we have. We like to champion that. And then Wellness Within Reach. My goodness, we have all kinds of different things that we fund to come alongside people in the community to make sure that they're getting the care that they need, get the resources they need. And I would love to point people to our website as well, which I'm sure we could put in the episode description.
Yeah.
So yeah, tap on that episode description on whatever platform you're listening to and check out our website because we've got a lot of detail that I think you'd find interesting and helpful. And then that last thing is scholarships. So far this year in 2025, we have raised over $50,000 to give away in scholarships. And that helps our people get better. And I think that's an important thing as we think about caring for the whole community. Our people are part of that community. So the foundation raises money. We've got some incredibly generous donors who are passionate about giving towards making our physicians, our nurses, our techs, our people better at what they do.
Yeah, I think that's great. And knowing that the foundation's not just investing in healthcare, but investing in the people that provide that healthcare and making sure that they have the certifications they need or the degrees that they would like to pursue. I think that's huge. You've given us a lot of real life examples of how donor contributions have made a tangible difference for our patients and staff and the community. Are there any others that you'd like to share?
Yes, if I can. Having not been here that long, I have still, in the time I've been here, been able to see some really cool things up close. And this year, I got a phone call, and we had somebody who was a patient of ours who had been receiving care with us for some time, and they wanted to meet and talk. And in doing so, I learned that this individual was a polio survivor. Wow. And had been in need of health care for different therapies and whatnot for this donor's entire life. And this specific individual had had such good care at Riverside, and I'm quoting, "The care at Riverside was so good towards me that it was starting to feel too one-sided, and I knew I needed to do something." And it was super powerful to hear that. In getting to know this individual more, what they said was, having received therapies and having to be involved in healthcare from the age of 3 as a polio survivor, this individual said that they couldn't go back and touch the lives of the people that cared for them at that age, but they could do something about the people that have impacted their care locally for the last several years. And that's what they wanted to do. And so this individual gave tens of thousands of dollars to enhance the facilities that they themselves were taking part in. And so that's just one quick, really brief story. There's a lot more nuance in there I'd love to share, but for the sake of time, I have to give credit to our partners on the clinical side. We have some folks doing really good work here to the point where it's driving people to have a response, to say that, wow, this is so special and so good. I have to do something. I have to give back because I want the people that come after me to have even better experiences than I've had. So anyway, just one story, but very powerful.
Yeah, I think that is a really powerful story. I think people often think, I have to give a lot of money to make a difference. But people are often surprised at how far even a small gift can go. Can you share a story maybe about how a smaller gift has made a big impact?
Yeah. Like I said, I've been here since January. And so if we're having this conversation a year from now, I'm sure I will have a different response for you. But here's what I do know. I see people all the time that can't write the check that they want to write. And they believe in what we do and they want to be a part of it. And so what we see them doing is giving a recurring gift of a smaller gift. And the size of the gift is kind of irrelevant to us. It's that we really believe that generosity heals. That generosity heals the giver, because I think we all know that it feels good to give gifts that we know that others need. We also know that it feels good to receive a gift, especially when we are in need. And so we see people all the time giving small recurring gifts, and those gifts compound, and they touch lives. They create ripple effects through our programs, through our scholarships, through our facilities, all these things we've talked about. Those really do add up. And I'll just say that's how I choose to give to Riverside personally, is I give a recurring gift every 2 weeks. And this is something I've committed to, and that's what me and my family have decided to do, to give back to this place that has impacted us. I was born at Riverside. We're not going to talk about how many years ago that was. And, I've lived a lot of life in this community. And so we want to feel really good about giving what we can at this stage of our lives and hoping that we're making a difference as well. So we really believe in this system of recurring gifts. And if you think you're not making a difference, I would challenge you. I'd say that you really, really can.
Yeah, for sure. We're going to take a quick break to talk about primary care at Riverside. Consistency is being able to count on someone to be there when you need them. At Riverside Healthcare, your primary care provider is dedicated to being in your corner, helping you and your family stay healthy and thrive. Find the right primary care provider for you at myrhc.net/accepting-new. From annual screenings to well checks and everything in between, having a primary care provider you can trust makes all the difference. And we're back. So to kind of pivot a little bit, the end of the year is coming up, and that's a big time for charitable giving. Why is year-end giving so important to the foundation's work?
Nationally, nearly a third of all charitable giving happens in December. For Riverside, that surge of generosity means that we can plan to say yes for projects for next year, for programs for next year, to facility upgrades, to critical community health programs. And it's also a time, I think, where donors are reflecting on the year, remembering the care that they or their loved ones received, and often considering the tax benefits of giving before December 31st. Now, here's what I'll say. I don't think that people give because they get a deduction. That's not been my experience in my interaction with donors. However, I do think it is good logic that if you're going to give back for the benefit of the good, wouldn't you rather that money go to a charity that you care about rather than having the government decide where those dollars impact?
Yeah, for sure. For listeners who may want to support Riverside and some of the great initiatives that the foundation has going on, what are some different ways that they can give, whether it's financial or through some other means?
Here's what I'd like to start with that, is that we really appreciate every act of generosity towards Riverside because we get to see the real-time effects. So every time somebody gives $1 or their time or their talents, it strengthens us. And so we really appreciate that. The ways that you can do that are many, and financial gifts are the most direct. And there are really quite a few flexible options to do that. You can go to our website and you can make a one-time or recurring donation through the pages that are there. You can make a tribute gift on our website as well. If you'd like to honor somebody or the memory of someone special, you can make a tribute gift to them, and we would love to help you do that. Another option that we have at Riverside, and I get to steward this process, is through estate planning. Riverside offers no-cost estate planning through an organization called Thompson & Associates, and it's a really special values-based organization, and we get to do that for anybody that has estate planning needs. And so oftentimes what we'll see as well is that maybe people can't give in a recurring way, in a way that they'd like to, but they will set up a will or a trust and make a gift in that way as well, naming the foundation as a beneficiary of a retirement account or whatever it may be. And so the Thompson process is really special. If you've never set up your estate planning, I would love to talk to you and make sure that you have everything you need, or at least have enough information to make the best educated decision on where you're at in your need for the process. And then lastly, sponsorships. Attendance at our foundation fundraising events throughout the year, like Pro-Am. This year we raised $117,000 for behavioral health through our annual Pro-Am. It was our 48th annual Pro-Am. And this is a nugget that I learned. We have the longest standing Pro-Am in the Midwest. Also, one of our other bigger events is Heartball. And we've got Heartball coming up March 7th of 2026. And Heartball is, okay, I'm going to caveat this. I've never been, but I've heard the stories and I've seen the pictures. And it's essentially adult prom.
Yes, I have been. I can say it is adult prom, and it's a wonderful time.
Yeah, I've heard really good things. It's a large 1,250 people in one room, which is bigger than any prom I ever went to. Black tie. It's like a really well done gala, and it only happens once every 2 years. And it's a party you don't want to miss. So I would love for you to go to our website again and check out the information on Heartball. And it's a great way to become a partner to the foundation and a partner to enhancing our community.
Yeah. You touched a little bit on estate planning and legacy type gifts. Can you talk a little bit about how those contributions can shape the hospital's future for years to come?
Absolutely. And you know what? I'll use estate planning as the example. Many, many years ago, we had somebody give a large gift through their estate. And that gift is still paying for those who are going through the estate planning process to do it at no cost.
Wow.
Forgive me, I don't know how many years ago that was, but it's been some time, I think close to 20. And because of that gift that was given through an estate, I'll use myself as an example. My family has become a beneficiary of that as we've gone through the estate planning process at Riverside. So you never know, you really never know the ripple effects that you might be making. And, you know, it's our job to find those stories and tell those stories, and it's good work to do. But you never know how an act of generosity today might impact literal generations down the road. As I think about the individual that made that gift to start this estate planning process, you know, it's benefiting my children who were born during COVID. That's a huge gap. It's a huge gap. So it's a really good thing.
Yeah, I think we've heard a lot about the great things that the foundation does and the opportunities for giving. But if someone's inspired after hearing today's conversation, where should they go? Or is there someone they can contact to make a year-end gift or learn more about what the foundation initiatives are? Yes, and yes. I would point you towards the easiest path is go to the episode description and click on the links. Go to our website, go to our pages, email us at foundation@rhc.net. We would love to talk to you.
Our phone number's on the webpage. Please give us a call. Ask questions. There's no commitment in asking questions, and we would love to come alongside you and helping you make an impact for the community that you live in.
Yeah. Thank you so much for joining us today, Logan, and sharing all this great information.
Oh my gosh. Thanks for having me. Let's do it again.
Yeah. And thank you, listeners, for tuning into the Well Within Reach podcast brought to you by Riverside Healthcare. To learn more about the Riverside Healthcare Foundation, visit riversidehealthcare.org/foundation.